we live?
We are.
We are. Hi guys. We're having a live Morpheus8 demonstration today with our patient Sarah. And the whole team's here today. Taylor.
Hi.
We're gonna get set up in a minute, but I just figured let me know if there's any questions or anything like that, and I will chat.
Yes, we actually have a few questions from our post from yesterday.
Okay, why don't I just sort of introduce myself and
absolutely.
just explain what we're doing. So I'm Dr. Tashakkor, I'm the medical director at Nexx MD. I haven't done a background on myself for a while, so I'll just briefly say my background is internal medicine and obesity medicine. I graduated medical school in 2013, did most of my training at UBC. I work at multiple hospitals. I practice full-time as obesity specialist. I did a year of training with the American Board of Obesity Medicine. I also look after patients with heart issues, kidney issues, preventive medicine, and of course we do aesthetic medicine, so multiple practices. I also work with Taylor. You want to introduce yourself?
My name is Taylor. I'm nurse injector here at Nexx MD. My background's in emergency care. So I met Dr. Tashakkor. I was doing that for 5 years, and now I'm here.
So yeah, Taylor and I met in the emergency department at the hospital, and we both have a passion for aesthetics, so it's been a few years that we've been working together here as well too, and she does injectables and a lot of the treatments. So today we're doing a Morpheus8 live demonstration, and I think it's, we get a lot of questions regarding Morpheus8. It's all over the place these days. A lot of people are interested in it, so we figured we would actually show what it looks like, what it can do, and who would be a good candidate. We have Sarah here, and we're going to focus on the abdomen for today. But the beauty of Morpheus8 is it could be applied in different areas. It could be applied to the face, to the neck, to the abdomen, to the knees, elbows, different body parts. But Sarah is a busy mother of two, and what she experiences and a lot of women might experience is after giving birth, even when you lose the additional weight and no matter how much you exercise, sometimes you might feel that you have an additional skin that is loose, and that's very frustrating for a lot of patients. If I may, I know you called the area, but I just want to explain. This is what we're trying to target here. So she exercises, she's very fit, but after the two kids, the skin is very difficult to get rid of. And this isn't something that it can be easily treated with just exercise or medications. Even surgery is a little bit aggressive for something like this. So she's not bad enough to, in my opinion, need surgery for a downtime and an extensive cost, but also, she wants to address this. So we're going to do something very cool today. We're going to do Morpheus8, and Taylor will go through the procedure, but we're going to do two cool things with it. The first one is she's had Pronox, and we have Taj, who is
hello everybody,
who is from Clarion, and so Morpheus8 is a great treatment, but there is some discomfort. We do numbing cream for an hour, which she's had for an hour, but we've also added Pronox, and so throughout the discussion we're going to ask Taj some questions about Pronox, how it works, and how it can make treatments comfortable, not just for Morpheus8, but even injectables, IPL, laser hair removal, anything. So one other thing that I'm going to do is we've already drawn some PRP from Sarah, and so I'm going to demonstrate that live. I'm going to inject PRP via cannula underneath the tissue, and we're going to Morpheus on top of it. And so this is a novel technique. I haven't seen that many other clinics do it, but it gives such a better results than Morpheus8 on its own. So I'll just pause there. Any questions or any comments?
We do have a DM from someone asking about stretch marks and whether Morpheus8 is a suitable treatment to treat stretch marks.
Certainly. So it is very effective for stretch marks. Morpheus8 requires, I would recommend to start with 3 sessions once every 4 to 6 weeks. but it's quite effective actually for removing stretch marks after each session is done. So yes, scar tissue is another one. A lot of people, if they've had a C-section and they've had some scarring, if they're developing a keloid scar, sometimes I use a combination of Kenalog injections as well as Morpheus8 and PRP within the scar. The results are very, very impressive. The Morpheus8 on itself is good, but if you add PRP and Kenalog on a keloid scar, it would be better. Sometimes patients have breast surgery, breast augmentation surgery, and they may have a little bit of a keloid scar underneath or in the axilla. So Morpheus is great with that as well too.
Perfect. We just got another question from Azine asking if it's good for removing other surgery scars, not necessarily with breast augmentation.
Certainly, it depends on the area, and it depends on how long the scar has been there, and skin type. Some skin types tend to be more keloid prone than others. Some certain skin colors you have to be cautious, but generally speaking, Morpheus8 is indicated for scar revision. So that is a common treatment that we do, and if we can get to it with the device, we will.
Perfect.
So the PRP is here. Thank you so much. Taylor, do you want to? I do have some gloves there. So if anybody has any questions regarding Pronox, how it works, Taj, do you want to tell us a little bit about Pronox?
Absolutely. So, as the doctor was saying, some of these treatments do have a little bit of discomfort to them. Luckily, they do have the ability to get some very high quality compounded numbing creams. But in certain cases, you have patients that are a little more sensitive and they need just a little bit extra to kind of help with that. The Pronox really works in 3 different ways. The first thing is in terms of anxiety. A lot of patients come in, especially if it's their first time, and they're just nervous about the treatments that are happening. If you're doing laser, for example, sometimes you're even covering the eyes, and they just feel a little bit uneasy about it. So the first thing that Pronox does is it actually puts them at ease and makes them a little bit more comfortable sitting in that chair. The second component that we see that helps is they're almost dissociated from the treatment that's going on around them. So you could be, in the middle of treatment and they're sort of just looking up into the sky, thinking about happy memories, and don't even notice that a treatment's happening. The third component is if they do feel the pain, it's sort of like if you've ever been drunk and you've fallen and scraped your knee, you're like, let's keep going. So you kind of get that feeling of pain, but it's not so intense that you need to stop the treatment. So those are kind of the 3 main mechanisms of action in terms of Pronox. I would say that it is appropriate for almost every medical aesthetic device or treatment out there. Anything from resurfacing, RF microneedling. We even have some patients that are afraid of needles that will actually use it for filler or even PRP.
Yeah, so people's, to add to what Taj said, people's thresholds for treatments are different, right? Yeah. So, sometimes we have patients that are just, they get everything done in one session and they go on, it doesn't even face them. Sometimes people need a little bit of help even with just Botox, right? So it's important to have the capacity to minimize patients' stress and pain because, if it's painful, people are not interested in these things. So is there any, can you drive after Pronox?
Yeah.
And how long after can you drive?
Absolutely. So, there are certain treatments out there that patients have had to take oral medication in the past, and what you'll notice is that they tend to book around that 4 or 5 p.m. when somebody can pick them up because they're sort of loopy with their medication. The beautiful thing about Pronox is that it actually has a very short half-life, so the effect and feeling of it wears off fairly quickly, but you put the patient in control. And so you say to the patient, if you feel that pain, you can take some more of this. If you feel like it's too much, just let go and breathe normal air. But it's usually just a few minutes after they stop consuming the gas itself that it goes away. That being said, they can do it for the entirety of the treatment. So if you have a longer treatment that may be up to an hour, 2 hours, you can actually utilize that Pronox for the entire time. By the time they've kind of cleaned up, gone to the front and paid, 5-10 minutes has gone by, it's actually safe to drive home.
And for those of you who don't know, this is very similar to what the dentist use. So there's Pronox is just the name of the modality that delivers this gas that dissociates you. So
absolutely. One thing I'd add to that as well is a lot of people ask about the safety profile of nitrous oxide. It's actually been used in hospitals for over 100 years. I didn't believe it when I first heard it, but they've used it in hospital settings for pediatric patients. They've used it for women that are going through pregnancy. So, if it is safe for a child or a baby, then of course it's going to be safe and tested for use in aesthetics as well.
Awesome.
So, if you can just, if I may just grab that chair.
Oh, yes.
Okay. So, I want to explain what we're doing here. So, what the Morpheus8 has is 24 needles that deliver heat deep into the tissue. What it does is it's able to make changes at the level of the surface and also deeper down. So you're basically approaching the skin and the tissue from different angles. And this is what's so novel and different about this compared to some other devices. What I'm gonna do is I'm gonna inject PRP extremely superficially in this distribution, and then immediately after we're gonna deliver Morpheus8. And so this is gonna give her better results, better recovery, less downtime, and overall better tightness. So I'll just show you how you do that. We've already gotten the PRP from her. We've done two vials here. So are you doing good?
I'm good, thank you.
Go ahead. Good.
How are you feeling, Sarah?
Good.
Good.
Can't feel anything.
So this has to be very carefully done. There are two big blood vessels that run along the abdomen here. So this has to be done by someone who's experienced. It's very superficial. And so the PRP goes little lines, tracks backwards. Good. Sarah, are you doing good?
Yeah.
Perfect. We just had someone ask us a question about combining Morpheus with other treatments and what kind of other treatments you would recommend combining.
So it's frequently combined with IPL. And remember, Morpheus and IPL address different things. IPL is more geared towards pigments and sunspots, and Morpheus is more towards skin loose skin, wrinkles. But you can do it together, and together people get a lot better results because you get rid of the pigments, you tighten the skin, and so forth. Perfect. Is that you have more? Just a little bit more. Sarah, are you doing good?
Yeah, good.
Do you want to tell us why this is important for you and why you thought this would be a suitable treatment for you?
Yeah, as you mentioned, I have 2 kids, and I try and work out as much as I can, but it doesn't always tighten the skin. And I've always wanted to try Morpheus8, and I've heard such great results. So here I am, to tighten up that skin.
Awesome. And do you find that the numbing and the Pronox helps with the pain management?
Huge, yeah. I don't feel, it's very, very, very comfortable.
Awesome.
Very comfortable.
Sarah's had treatment to her face as well too, Morpheus, and then now we're doing that.
Yeah.
Perfect. So we're gonna switch to the other side. Was that okay?
Yeah, it's great.
Yeah. So we're gonna switch to the other side. So Taj, is there anybody who cannot have Pronox?
Sure. So there are some contraindications, very few of them. For example, those who come in with a collapsed lung, pneumothorax, which typically aren't patients that are coming in for aesthetic
Hopefully they wouldn't be coming here for
Exactly.
the collapsed lung.
The other one being those, you ever see those little old ladies wheeling their oxygen tank? You don't want to take somebody off of their oxygen in order to use Pronox. Other than that, there's not a ton of major contraindications. If somebody has had eye surgery, for example, or gone scuba diving, those could be two others. But again, typically the types of patients that are contraindicated wouldn't be showing up for a Morpheus8 treatment, at least not right away.
Most people would be a candidate.
Absolutely. Again, the safety profile and the amount of experience we have with that particular device is so vast. Pronox has actually treated over 1 million patients at this point, all throughout the world. And so we do find it to be a really good adjunct for all of the types of treatments you guys are offering today.
Perfect.
As you can see, our patient's barely moving and has a smile even on her face. So one of the things we find is that sometimes patients will have this idea of no pain, no gain. And so, they want to tough it out to go through a treatment, but then they may not show up for their follow-up, or when they're talking to their friends about it, they do describe that feeling of discomfort. In this case, she's actually quite happy and pleasant, and when describing the results, she's going to speak very positively, but also the overall experience itself.
Perfect. Whenever we do these treatments, we should always remember what we're doing. The reason the Morpheus works is we're causing heat injury to the tissue, and that's what's going to stimulate collagen and elastin buildup. So inevitably there must be some discomfort because you're giving heat. Without it, it doesn't work. The analogy I always give is if you go to the gym and you're working to build muscle, you have to rip your muscle in order for it to get bigger. You have to control damage it. So inevitably, the better the treatment it is, in most cases, the more discomfort is associated with it. But you can see here the PRP is all underneath the tissue, and then now Taylor is going to go ahead and start. So far, okay?
Absolutely,
Yeah.
yeah.
So this is the PRP is along the track here, and then we're going to go ahead and work and tighten this and make things better.
Awesome. We just had a question. How many treatments are needed when it comes to Morpheus?
Taylor, you want to?
Okay, yeah. So for Morpheus, first we recommend that patient will do a series of 3 to 4 sessions, one every 4 to 6 weeks.
Awesome.
Go ahead and get started here.
And if someone has melasma and you're treating the face, is there anything that you guys can do as far as the technician standpoint on adjusting settings?
Usually for that, we would try going less on the energy here. But Bristol here will be able to talk more to that.
Depending on our client's skin type, I usually recommend starting with a protocol of a skin brightening routine, like topical skin brightening agents in advance of their treatment. Even though Morpheus doesn't specifically have an issue when patients are prone to hyperpigmentation, because it's going deeper, it's sort of bypassing that danger zone when it comes to creating hyperpigmentation. I'd have them start on some skin brighteners in advance and continue those throughout and after their treatments to avoid any further hyperpigmentation, but we haven't actually had any issues like that so far.
Awesome. And how deep do these needles go into the skin?
Right now Taylor's working at 6 millimeters, so there is a burst mode on the Morpheus8 body handpiece specifically that will deliver heat at 3 different depths. So with each pulse you can see the needles are going at 3 different depths, which gives better tightening because we're targeting different layers of the skin.
I think one of the important things with these devices is that there is a degree of performance regarding on who is operating it, because if you notice, if you don't get a very good contact on the skin, or if when it's done too fast or not focused, or someone's not taking their time, you're not going to get as much of a results, And right contact has to be there. It has to go deep enough. It has to be done properly. So it's important to make sure that your technician is experienced and has done a lot of this.
And how long do the treatment's results last?
Well, you know, with Morpheus, you're building collagen and elastin. So once you have that collagen and elastin, it's yours to keep, right? So generally speaking, most patients start 3 sessions once every 46 weeks, and then they have a maintenance once every 6 months or a year, depending on what results they want. The results last anywhere from 1 to 4 or 5 years. As we get older, we lose collagen. That just happens with everybody. So this just gives you more collagen for you to keep, and it lasts you the same amount of collagen that other collagen would last. So anywhere between 1 to 4 years. Obviously, the more treatment that you do, the better results that you get. What's the comfort level? Do you feel it at all?
It's very, very minimal.
Yeah.
Very, yeah.
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 So Sarah's had numbing for an hour, and we can see immediately after there's a little bit of a redness. The good thing about this treatment is that there's not much of a downtime either. People can just go back to work the next day or even this afternoon. I wouldn't exercise immediately after. I would keep the area very clean, avoid any, pet hair or any, don't go swimming in a lake or something, but downtime is minimal actually.
One of the biggest differences with the body piece that we've noticed versus the standard Morpheus handpiece that we've been using since 2020 is the speed of it. So rather than 24 pins, the body handpiece has 40 pins, which just allows us to cover more surface area a lot more quickly, which not only is more comfortable for the patient, but you can just get more effective tightening by treating a larger area so that you're getting that like circumferential tightening all the way around the belly button. And then the burst mode that delivers that 3 different depths of heat so you get better results. We used to use the standard one on the body, but you're a little limited in terms of the depth and then the time that it takes. Oftentimes people just hit their kind of comfort threshold after half an hour, and this way we can treat it much more efficiently and more surface area.
Mm-hmm. We just had someone ask a question about fat remodeling and how Morpheus body can help with that.
You can speak a bit louder just because of
So
voices.
with the body handpiece, we have the ability to go up to 8 millimeters in depth. That's going to depend a little bit on the patient. So for somebody that has a little bit more body fat or higher BMI that's carrying some weight in the lower abdomen, we can use that full depth. But with certain patients that are lean like Sarah, we want to use just a little bit less depth but still targeting all the layers of her skin. So some people are going to be going after fat remodeling. We're using more heat, more depth to get that fat. Can also be used for the submental area to reduce fat under the chin. But in certain clients that just want skin tightening, we don't need to use that full depth.
Awesome. And can it help with cellulite as well on the legs?
Yeah, definitely. So by increasing the amount of collagen in the skin, we can smooth the skin as well. So if they're noticing some texture on the back of the thigh or the front of the thigh, around the knees, oftentimes the Morpheus treatments will help because we're kind of thickening that skin back up. So when they lose a little bit of elasticity or collagen, then it tends to show that dimpling a little bit more. It doesn't cure the underlying cause of cellulite, of course, but it definitely improves the appearance of it. And with annual treatments, you should see a good reduction in cellulite. Still doing okay?
Yeah.
Sarah's
Fine.
doing
Sounds
like
great.
nothing's happening.
Totally fine.
She's
I'm
having a
so
nap.
relaxed.
So in terms of the protocol for the face, for the abdomen, the depth and the settings are different, and those are customized to the patient. The technician does that. But in terms of protocol of numbing, coming for Pronox and getting numbing beforehand is standard. So if patients are getting their neck and face done, then we will numb them for an hour. We'll tell them to generally book 2 hours of a treatment. And then the first hour is the numbing and the pain management, and the second hour is the treatment. At our clinic, we have an emergency number for all patients. So everybody has our cell number. They can call us or message us any time of the day or night. We're proud of it because then if patients have any questions, any complications, anything they're not worried about, they know that they can reach us anytime. I think it gives them more of a peace of mind as well too.
Mm-hmm.
The other question I get asked a lot is, can I treat my whole body with it? So we're happy to do like multiple body areas, and we love to treat it all over. The most important thing is just that we limit the amount of surface area that we treat in any given day just to allow the body to metabolize the numbing cream that we use because it's quite strong. So we do recommend giving it at least 2 days between treatments, so there's no reason you couldn't come back a couple days later to say treat the thighs or another body area, but we do like to limit the amount that we treat within any given day to about 2 hands worth of treatment or an abdomen. So if you'd like to do your arms or thighs or different body areas, we just split those up by a couple days at least.
Coach, is there anything else you have to add for Pronox?
Yeah, I mean, I think we've covered off, what it is, how does it work, some of the different types of treatments you can do it with. Just to your point earlier about the amount of time in terms of coming in, people are busier and busier these days. And so, in the past where you would have had to numb for about an hour, now incorporating the Pronox, sometimes we can actually minimize that time of numbing. So rather than spending 2 hours in clinic, as much as it is fun to be here, you may be able to actually reduce that time down a little bit and either do additional treatments or get in and out a little bit quicker. But I have tried it. It's definitely fun, and it does make the treatment a little bit more enjoyable, not only for the patient but the staff as well. Most of the staff don't like inflicting pain on their patients,
Yes.
and every once in a while, listening to the patient kind of open up while they're sitting there and just in a much more happier and jovial mood than kind of clenching and making a difficult situation throughout the treatment. I think it's a fantastic option.
And is there any side effects with the use of Pronox?
So there are some side effects that are possible. One of the nice things is that the types of nitrous oxide they've used in hospital and dental facilities do tend to have a much higher percentage. And so patients will experience a higher percentage of side effects with those types of systems. Pronox has been governed at a 50% nitrous oxide mix and 50% oxygen. So there's no risk of asphyxiation, passing out, things like that. The most common side effect that we've seen is patients may feel a little bit nauseous. It's really only about 5% max of patients that feel that. And if they do experience that, we just say to them, look, remember you're in control. If you start to feel a little bit nauseous, just take it out, breathe some normal air again, and you'll kind of revert back to your baseline.
It's generally well tolerated,
Yep.
so we haven't had any major experiences, bad experiences with it.
No, again, we've treated more than 1 million patients at this point. So the results are in, and one of the nice things that Dr. T was talking about earlier is that there's lots of devices out there. There's lots of Morpheus8, but it's so important to have not only the right medical director, the right technicians that have been trained to use proper technique, but also things like Pronox or numbing cream that create a much more enjoyable experience. Just going to any place that has a similar device and looking for the cheapest price, it does tend to come with its own side effects. So if you're looking to get these treatments done, let's not forget this is your face. It's worth the investment to find the right clinic. And one of the things I love about this place too is the artwork. So imagine sitting here on Pronox and you're looking at these beautiful photos, and I think it's fantastic to have that whole experience.
So I just want to show, I think we're ready to wrap up unless there's any questions, but I just want to show what this looks like immediately after. These are the entrances from the PRP. This is the treated area. It already feels tighter, and you can see what's treated and what's not treated. Minimal redness. This will get better in a day or so. And she's quite comfortable. So
Very comfortable.
yes, yeah.
Awesome.
We could do this once every 4 to 6 weeks for 3 sessions, and in conjunction with her exercising, it's going to tighten everything, and it's just going to make everything a lot tighter.
And how soon will she see the results after this treatment?
3 months, with as early as 2 to 3 months. But the thing with Morpheus or any treatment that builds collagen, for example, Morpheus or Sculptra, which is an injectable that builds collagen, what happens is this is different from filler. When you put filler in somebody, right away you see it. When you put Botox in somebody, 5 days later you see it. With this, because it requires your own body to generate the collagen and the elastin, it does take time, So you have to be patient and have a good trusting relationship with the clinic. But the good news is it lasts a lot longer, because guess what? It's your own collagen, so it's there to stay. So 2 to 3 months, you're gonna start. A lot of patients. Oh, you mentioned like after you got your face. What was your experience?
It was wonderful. It was it was a little bit red for a couple hours afterwards, but the next day it was fine.
And then did you feel any tightening or anything?
Yeah,
like
I
that?
definitely felt tightening. I did have some friends comment how my skin was glowing, so
Perfect.
it was a good experience.
And that's only within a week. So 2 months, 3 months, 4 months, 6 months, it just gets better and better. We haven't had anybody who has regretted Morpheus in our practice. We've had patients who have not wanted fillers and so forth, or even other treatments. But Morpheus, if you give it the time and be patient with it, it works. So
last thing I was going to mention is, because you're in the clinic for a longer time with the numbing and getting your treatment, it's a really good opportunity to pair it with some of our wellness services, like doing IVs or getting your vitamin B boost, doing some glutathione, and just kind of learning about the other things that we do at the clinic to make the most of your time and come and get some work done. No one will disturb you. So for summertime, a lot of clients are concerned about what they can and can't do because it's sunny. So with this amount of treatment, you don't want to go to the beach the next day, but after a couple of days you can get back to your normal activities, but meanwhile you can kind of make good use of the time to do some other wellness services too.
That's awesome.
So is there anything else you want to add to finalize?
No, I think that's it.
Perfect.
It was good.
Amazing.
Good. Thank you so much.
Oh, my pleasure.
Appreciate it.
Thank you.
Thank you.
Thank you to everyone tuning
We'll see you
in.
next
Thank you very much. Next time we'll see Dr. T taking
Yes.
Pronox. So we've got
I'm
good
gonna
live
do- I'm
video
gonna do
as well.
live there next time as well.
Yeah.
So I'm happy to do that next time.
Awesome. Thank you.
Thanks, Taker.